Hi, my name is Lydia and I'm a nursing student at the University of Michigan. I'm going to be presenting to you today a patient I work closely with. Patient is a 74-year-old African-American male. Marital status is unknown. His former job was as a bus driver. He had been a patient at St. Joseph's of Mercy's Hospital many times, but was finally admitted to become a resident of Heartland Healthcare Center for a number of health concerns, but mainly dementia and hemiparesis on the right side of his body. His dementia includes forgetfulness, but he is awake, alert, and mostly oriented. There is no signs of the dementia getting better or worse. He is receiving no treatment for it, has depression associated with it, but does not know he has it. Patient also needs help with activities of daily living. Pain has recently increased in his left wrist and back. The intensity of the pain in his wrist and back decreases with medications, but still affects him daily when he is awake. It hurts when he moves, but pain is reduced by staying still. He states he takes medications to help the pain, that he can't move as easily as he'd like to, and that the pain causes him discomfort. Vital signs are stable for his age. Blood pressure 126/65, temperature 98.6 degrees Fahrenheit taken orally, pulse 77 beats per minute, and respiratory rate 16 breaths per minute. Past medical history: hypertension, diabetes mellitus, cerebrovascular accident, seizure disorder, dementia, depression, dyslipidemia, right-sided hemiparesis, arthritis, osteoporosis with pathological humerus and clavicle fractures, cholecystitis, and cholelithiasis. Immunizations are the influenza vaccine, allergies to Flagyl, and past hospitalizations: July 2014 for fever, August 2014 for chest pain after a fall, February 2015 for headache, acute wrist pain, and pressure ulcer. Past surgical history: elective laparoscopic cholecystectomy for cholecystitis converted to open cholecystectomy to pass small gallstone, ERCP and sphincterectomy for choledocolitis, tracheostomy, and PEG tube for respiratory failure. Current medications: patient is on numerous medications for seizures. For example, patient is on Dilatin Infitab chewable tablets 100 milligrams by mouth 3 times a day. Patient is also on numerous medications for supplements. For example, patient is on thiamine HCl tablet 100 milligrams by mouth once a day. Patient uses hydrophor ointment on legs and feet every night for dryness. Patient uses metoprolol taratate tablet 25 milligrams by mouth 2 times a day for hypertension. Patient takes Novolin R solution 100 units per milliliter insulin injected subcutaneously before meals for diabetes mellitus. Patient is on omeprazole capsule delayed release 20 milligrams, 1 capsule by mouth once a day for gastroesophageal reflux disease. Patient is on Senna tablet 8.6 milligrams, 1 tablet by mouth at bedtime for laxative. And patient takes Tylenol tablet 325 milligrams, acetaminophen, 2 tablets by mouth once a day for pain. Functional assessment: patient reports no alcohol or tobacco use, but does use caffeine. Patient uses safety devices, including a wheelchair and seatbelt, and gets adequate sleep and nutrition. He exercises when he can, although it is difficult because of his right-sided hemiparesis and use of a wheelchair. Psychosocial data: patient states he is close with his brother, mom, and dad, yet patient's mother and father are most likely deceased. He states he is very spiritual and attends a Baptist church. Patient completed high school as his highest level of education, reports no stressors or environmental hazards, and receives health care when necessary. Family history: history of hypertension and cerebrovascular accident, but family member of origin is unknown. Mother had a history of diabetes. Neurological: given patient's diagnosis of dementia, seizure disorder, and depression, it is important to assess neurological status. Patient denies any numbness, tingling, burning, loss of consciousness, insomnia, anxiety, past 10 injuries, headaches, dizziness, sensory changes, exposure to toxic chemicals, or seizures. However, patient's chart states he has a seizure disorder. Patient has no concerns about memory or concentration, but does have dementia. He states no unsteadiness or loss of balance or coordination, however, does use a wheelchair. Patient denies difficulty with speech, but upon interviewing him, patient's speech is slow, soft, and slurred. Patient states he has difficulty swallowing and weakness on his right side. The neurological assessment of my patient was incomplete because patient said he wished not to do some particular portions of the exam or that he could not do some portions of the exam. Upon the mental status portion of the assessment, patient's appearance is appropriate for the occasion and weather and appears his stated age. Patient's level of consciousness is alert and oriented to person and place, but not the date or time. He expresses somewhat of a confused facial expression, but is responsive to questions asked of him. His speech is slow, soft, and slurred, but vocab is appropriate to the age and experience. He denies the attention span to spell the word world backwards. His short-term memory is intact, but long-term memory is not. He does not understand abstract reasoning assessed by what the proverb, the grass is always greener, means. He denies the ability to count backwards from 100 by sevens for the intellectual ability assessment. His thought process is intact in that he can say a sentence, but he cannot write it due to the weakness on the right side of his body. Motor function assessment. Upper extremity fine motor function is intact in that he could touch his left finger to his nose, his left finger to my finger and his nose, and rapid alternating movement of his left hand. Patient's general motor function could not be tested, and Romberg test could not be completed due to his use of a wheelchair. He denies lower extremity fine motor function, or the ability to move his heels down his shins, and patient did not wish to complete the sensory portion of the exam. Ankylosing and Babinski reflex could not be tested for. Musculoskeletal. Given patient's complaint of acute wrist and back pain, along with weakness on his right side, it is important to assess his musculoskeletal ability. Patient reports past clavicle and humerus fractures. He denies any joint swelling, redness, warmth, or deformity, but does have pain in his left wrist and back upon movement. Patient states no limitations in range of motion or limitations in performing activities of daily living or weakness. However, patient does use a wheelchair, so therefore has some limitations in range of motion and ADLs. Patient reports history of arthritis, osteoporosis, and complete immobility of the right side of his body. Upon musculoskeletal assessment of my patient, his muscle mass and bone structure is weak on his right side due to his hemiparesis. He can move his neck in all directions. He can only move his arm and leg on the left side of his body, and the range of motion in his left shoulder, elbow, finger, knee, and ankle is normal, but range of motion is decreased in his wrist in that he can move it, but it causes pain. Range of motions in his hips and spine could not be tested because he was seated in a wheelchair. The muscle strength in his left deltoid, bicep, tricep, and fingers were all graded as a 4, with full range of motion with some resistance against gravity, while the muscle strength in his left wrist was graded as a 3, with range of motion and resistance with gravity. Muscle strength in his left adductor, abductor, hamstring, and quadriceps were all graded as a 3, with full range of motion against gravity, possibly due to his use of the wheelchair. The muscle strength of his right side of his body could not be tested due to his right-sided hemiparesis. Pertinent system number 1, cardiac. Patient has a past medical history of dyslipidemia, hypertension, diabetes mellitus, and cerebrovascular accident. Together, these factors put my patient at risk for cerebrovascular disease. According to an article published by the Oxford Journal of Rheumatology, patients with multiple risk factors such as hypertension and dyslipidemia, like my patient, are at a high risk for morbidity and mortality as well as atherosclerosis. Therefore, it is important to do a cardiac assessment on my patient. Pertinent system number 2, heat. Patient recently complained of throat discomfort and difficulty swallowing. He states something is stuck in his left lateral throat. He vomits because of gagging. When he belches, fluid comes up in his throat, but there is no pain or shortness of breath. According to a recent journal article published by the Radiological Society of North America, it is important to assess this throat discomfort and dysphagia using heat due to patient's diagnosis of GERD. Studies found dysphagia is more common in patients who have GERD than those who do not. Also, some other conditions that could put patients at a higher risk for dysphagia include Alzheimer's disease, multiple sclerosis, Parkinson's, and stroke, some of which my patient has, and risk is also significantly higher in persons over 65. If dysphagia is untreated, it can lead to malnutrition, pneumonia, aspiration, dehydration, and even death.